I'm Greg Baldwin. I'm from OneDegree. A huge thank you to Care Message for inviting us and to be a partner and participate in this event. I'll just get started with a brief introduction of me. I'm the head of partnerships at OneDegree. In a past life, I was one of the founders and the CEO of volunteermatch.org, which some of you may know is a national platform that helps tens of thousands of nonprofits recruit and engage amazing volunteers. So I've been in the technology for social good nonprofit space for many, many years, and I'm excited to be a part of OneDegree and helping this organization continue to build tools and services that bring people together. And in this particular, the work that we're doing today is really to level the playing field and get more people connected to the life-changing social services that they need in their community. I will give you the brief background on OneDegree. It sounds like some folks know a little bit about OneDegree. We've been around for 12 years. The organization was started and is founded by our current CEO, Ray Faustino. And Ray, much like Cecilia, grew up he's a first generation with his family in LA and was the family's point of contact when he's in his teens to navigate the social service landscape in LA. And OneDegree, I think, is in many ways is the solution he really desperately needed when he was a kid, and continues to evolve and grow as a tool to connect folks to life-changing social services. What we're going to talk about a little today is really the intersection between screening and social service referral. And that's some work that we've done. I see some folks from Northeast Valley are on the line. And we've piloted this work with folks in LA, and I'll get into that a little bit. And also I'll show you some of the newest stuff that we're working on, which is in California. It's really exciting work. We're partnering with 211 Ventura to help 211s do social service screening for ECM clients and send pre-screened folks to local ECM providers. And that's something I'll demo in a few minutes. So let's just get started. A little bit more of an overview on OneDegree. Our work, we are a nonprofit. We're headquartered in Oakland, California, but we're really virtual, and we have folks in Seattle and across the country. Our mission is to empower people to build healthy and fulfilling lives by improving access to life-changing social services. We understand we're operating in a very confusing landscape where you've got a whole bunch of folks who are struggling to find solutions in a complex and fragmented ecosystem of social service providers. And then you've got on the other side of the equation, you've got organizations, like FQHCs, local hospitals, nonprofit organizations, county health departments, who are all trying to get their customers, their clients, their patients connected to the services that they need. If you've been operating in the space, folks know how complicated these landscapes can be. And OneDegree is building next generation information and referral platforms that are making it easier to have an integrated solution that allows folks to do everything from screening to secure and safe referrals to local organizations. We've got all of the systems that are available in many of the commercial information and referral providers. What makes us really special is our commitment to partnering with local folks and the fact that we're a nonprofit alternative to commercial INR solutions. We've also been able to lean into a role as a infrastructure provider rather than just building products and services one-off, as many of the commercial providers do for the big stakeholders. We really think of ourselves more as community infrastructure, more so than a product for any one stakeholder. That is, it's one thing to talk about what we're doing, but what I'd really like to show you is something that is very exciting new work, and it builds on things that we've been doing for a while. You can see a part of our diagram here is that we've got social needs and eligibility assessments that are integrated into a directory of resources that then can be used to redirect a patient or a client directly to a particular local service provider. So I'm going to just show you what that looks like in this really exciting pilot with 211 Ventura. 211 Ventura, for folks that don't know, is not only the organization that, or the organization that runs 211 Ventura is Interface Children and Family Services. If you live in California, you might be familiar with them. In addition to running the 211 Ventura solution, they also they are the call center for the 211s for 38 other counties in California. So they are an organization that does a lot of work across California. The project that we are working with them on right now is a project to ultimately re-platform their entire 211 operations off of some legacy technology that they've been using into a more modern technology stack. But to get started, we are tackling one of the key challenges in California today, which is getting folks enrolled in enhanced care management services. Enhanced care management is one of the features of the larger Medi-Cal program, and it's aimed at vulnerable populations that are, it's 100%, it's a health equity strategy to get folks that are really in need of additional support and care, particularly with social service coordination, to provide those services for folks in California. In Ventura, just to give you a sense, Ventura has two primary medical health plans. There's Gold Coast and there's Kaiser. Gold Coast is almost all of the patients. And right now, their ECM enrollment stands at 1.1% of their Medi-Cal population, or of the population of folks that are being served. And that is against a target of 5%. So you can see in just a place like Ventura County as a good example, they're not meeting any of their ECM enrollment targets. So this project is to allow give 211 operators the technology that they need to do ECM screenings and then refer them to local ECM providers. So let me give you, this is our demo site, so hopefully everything will work smoothly. But we're going to show you how this thing works here. So now imagine you're a 211 operator. Someone calls in. You're going to add a new client. Test, Mick, test. You can put in an email or a phone number. I'll put in mine. If I were doing this with folks live, I'd put their phone number in, but I don't want to do that because it'll actually start sending you text messages, which somebody mentioned before. Got to put in a date of birth. This we use to help dedupe with other systems, and you can pick English or Spanish right now in the platform. We'll be adding other folks. The system does a dumb check to make sure that we're not duplicating based on date of birth or first name. The results match existing clients. Are you sure you want to proceed? And I know I do. Oh, I'm not seeing your screen if you intend to be sharing it. That is not good. Why is that happening? Good point. Thank you very much. Let me try again. Thank you, folks. Thank you, Mike. Are you seeing a screen now? I can see it now. Awesome. So you can see now that we've built to kind of back up a little bit. This is a white label version of the OneDegree platform, and you'll see kind of in the grayed out, 211 Ventura is the client here. The system is powered by OneDegree technology, but they are the client delivering the service. You can see we're at this point where I just added a new name in here. and we're adding a new client after the system is saying, are you sure that this isn't Tim McTesty? And that this is really a new client. And here is the new client. And we are going to do, this is, test McTest's record in the system. Here's the current client information about this person. We could just jump right into, making referrals on behalf of that client. But what we're going to do in this demo is we're going to do the enhanced care management screening. And this will allow us to start an assessment. And we'll just run through this quickly. Here are the questions. May I confirm you're enrolled in Medi-Cal? Yes. Which plan? Gold Coast. What is your ID number or CalAIM number? We happen to know from our work that this is, is a structured number. So we're doing some validation on this. It's 9 characters, starting with 9, A, B, C, D, E. And the ends of the letter. And then here are the screening questions. It's built off of the domain experience down at 211 Ventura. ICFS is actually running their own ECM program as well. And there's a lot of other solutions in place to like what kind of questions you could ask to do ECM screening. The real challenge is there's just not enough folks doing this. The 211 in Ventura receives, I think it's 40,000 calls a year. And 50% of the folks that call in are eligible for Medi-Cal based on their existing work. So we are digging in now to, are they currently experiencing homelessness? And I'll add some healthcare utilization is another criteria. So I'm going to answer yes to a lot of these just so you get the most exciting results at the end. Healthcare, mental health condition. It'll ask you a little bit more about what your mental health condition is. Has your mental health been impacted? Yes. And additional risk factors. These are some of the other criteria to qualify for ECM. If you've been released from jail within the last 12 months, you also qualify. This is probably, seems the least significant and is probably the most important piece of this online screening, is actually getting what is referred to in this space as telephonic consent. One of the biggest barriers to getting ECM treatment is getting the patient's consent to actually send their information to the healthcare provider. And typically this is done, on a PDF form in real life, but finding these folks and getting in touch with them in real life is obviously super hard. And that can add months to the enrollment process. Gold Coast accepts what is referred to as this kind of verbal telephonic consent. So the 211 operators are reading a script. If it is likely you are eligible for Medi-Cal's enhanced care management or community support services, I'd like to be able to share your private information with them. Do I have your permission to share your information in order to assist you? If they say no, then you're kind of back to the way the world works today, and someone would have to reach out and find another meeting. But when they say yes, this can get bundled up into the information that we'll then share with a provider that they can use for billing purposes. So let's just put in Ventura as my location. I could put in a specific address, but I don't have one in my head. You can review all of the information, and then when it's finished, you'll get a results likely eligible. You'll get the local ECM providers in Ventura County who match the population of focus based on the information that was just collected in the screening. And we could refer this patient directly to one of the providers. I picked Kahio Health. I can continue with the referral. This information is actually going to be sent. What's in the space, the jargon is a closed loop referral. But what that really means is we can send a note to the client. So, as promised. And this will send, depending on your settings, right now, This will send basically a confirmation to the client. And you can see you can adjust that. You can turn that off. You can turn it on. You can send an email. If there was an email, you could add an email address right now based on the client's preferences. But then it also will send a note to the agency along with all of this client information, which is really the big innovation. And the reason that's so important is because with that information, the provider doesn't have to repeat this assessment, which is what's happening in the real world today often. So they'll be like, oh, this person might qualify for ECM. And now you can go find them, go see if you can track them down and set up an appointment to ask them all the same questions again. 2-in-1's trying to eliminate all of that, give all of the necessary information, including consent, so that Cahio Health in this particular instance can actually start the billing process, the enrollment and billing process for ECM with Gold Coast. A pre-qualified ECM candidate. You send the referral, confirm that you have permission. You sure you want to submit this referral? Boom. You can print things. You can go back and do various other things. I see a message. How does the provider or clinic get hold of these responses? Great, awesome question. In this particular instance, I should have prepared my demo a little bit better, but I always get concerned about switching accounts. But they will have an account. Cahio Health has already accepted the invitation to participate in this pilot program, and they have an account, and they will see, they will get this information, basically a version of this page where they'll be able to see not only the client's information, but they'll actually get to see all of the. See if I can see if this will pull up right now. It's not pulling up for me in this demo, but they'll have all of the data. I'm seeing if I can find the assessment data. There, I'm not pulling it up in the demo because I'm in the wrong account. But they will be able to see all of the answers to the questions and can submit that as a PDF to Gold Coast or in another form directly through Gold Coast's billing system. We're also working on the APIs so that this information ultimately will flow into be set up so that it can flow into an EHR, and we're obviously working to make it both fire compliant and compliant with California's DXF data exchange standards. So that's all kind of next step in the process. But for the time being, they have a private and secure account they can log into, and they'll be able to see all of this information, which will look a lot like, if I go back to the home page, all of the accounts, look very similar. So if you were to log into Cahio Health, you would see that there is a new client. You can open that information up. Whoops, I'm clicking on the wrong link. Let's see if I can click on Testy McTest, and you'd be able to see the details of that particular referral. And you can also, they'll also be able to respond and say that, great news, this was enrolled, so they can close the loop with 211. So this also can serve as a collaboration tool, so folks know what the status of these referrals are when they're collaborating with other folks. Is this program only available currently in California? It's not even available all the way in California yet, Emily. It's right now it's a pilot program in Ventura, and we literally it hasn't even launched yet. It'll launch next week with the ECM providers that have agreed to participate in the pilot. We're then going to expand it to community supports, and the goal will be that interface, because they're answering phone calls for 211s all across the state for 38 counties, that the first rollout will be to counties that would like to participate, 211s essentially that would like to participate and have be able to provide this service in their county based on their program and service providers on a county by county basis. So we're excited about it. It's just a good example of the type of work that is really fundamental, we think, to improving the quality of care in California and beyond, and leveling the health leveling health equity challenges and issues in a way that's very practical and can have a real impact on people's lives, and hasn't been done despite millions and millions, tens, hundreds of millions of dollars spent in California on new technologies. The way the system is set up right now, there's a lot of people with the tools to sort of collaborate with each other, but there's nobody that is really focused on doing these screenings, and 211's largely been left behind in these conversations. We think that's a real shame, and they're an obvious point of entry. In California, Ventura or ICFS will, I think they did 100, I should know this number. I think it's 1.6 million calls last year in California. So there's going to be tens of thousands of folks who are likely eligible for ECM services. Now, getting them connected to the right providers, we'll have a system and a framework for doing that at scale. So we're super excited about that partnership and where it can lead to other partnerships with 211s, hopefully not just in California, but across the country. Right now, the average 211 doesn't have the technology stack to be able to do any of this. And as another nonprofit service provider, we're really trying to change that landscape moving forward to give them better tools and services. So hopefully that was helpful. I am going to stop sharing this. And maybe I'll just, before I drop out of this, the system itself, while we've just talked about making a referral, the vision for this platform is that any organization in Ventura or that was, working with the local 211, instead of the way the world works today, where 211 providers basically keep a resource, basically a database of information, this platform will allow any of the participating organizations, if they want to come in and participate, they'll have access to manage their information about their organization, what opportunities they have available, all the sorts of things that we've come to expect in the digital landscape. But in the existing information and referral world, none of these tools and technologies are really operating at scale. There's some for-profits that are sort of getting close to it, but they don't have widespread adoption by any of the local social service providers, though they do have some big clients on the healthcare side of things that are trying to force adoption into the social services landscape. But obviously, it's fraught with um, poor power dynamics and low engagement and adoption among the CBOs. We think there's a better and different path forward by working with trusted local folks that doesn't exist in the commercial landscape today. So you're seeing just some of the tools that these nonprofits will, who agree to participate, will be able to build networks to share amongst each other, and not just because of a big healthcare provider. They'll be able to edit, staff that have access to their information. And we're doing all of this in a HIPAA compliant and secure way, so that all of the information that's stored in the system and who has access to it can be managed at a specific organizational level, and not just as as you would expect it would be designed and architected. So let me stop that. Are there other questions out there before I just conclude by tantalizing you with some things that are on the horizon? All right, I'll stop sharing. And then here's the last little bit of what's to come. On top of all of these exciting things, obviously, I've managed to talk for 25 minutes without mentioning the topic on everybody's mind. Oh my God, AI. OneDegree received a significant grant just over the summer from the Google AI Accelerator Program, which is the nonprofit arm of Google and google.org. And we are working on two exciting projects in all of the buzz and hype about AI. There are two things that we know in our work will be helpful. The first is an AI assistant that will be able to translate um, basically search criteria into results. So instead of coming to the OneDegree website and doing a traditional search of put in your zip code, you'll be able to interact with a chatbot. Share I'm looking for food banks in San Francisco, and the AI assistant will be able to pull that up and reply, giving you links to the information. We are also doing it we're managing it, so it's just in information that's been curated and collected by OneDegree, so that you're not getting links to lots of bad information. There's a lot of bad information in the space, so that's an important criteria. And then it's also harder to train these things with prompts than we might have imagined, but that project is coming along and will be available on the system beginning in the spring of next year. And then the other tool that we're working on, which we're super excited about, is using AI and an AI agent to actually collect information from existing social service providers, particularly enrollment information. Think PDF forms, and find publicly available PDF forms and convert those PDF forms into digitally editable intake forms to just make it, sort of simplify the process for someone who would be, if anybody's ever tried to fill out a PDF in their real life, everybody knows how miserable it is. You got to try to print it out, or you try to fill it out online, and you never use the system is always goofy, and it's never clear to me whether I'm filling out the form or I'm editing the form. I'm sure you've all wrestled with that. The idea would be to just make it super easy, create a digital form. You could fill it out, and then create a PDF version that you could then send to a provider in kind of the worst case scenario. But in the best case scenario, the providers could claim their account, and we would be able to share with them digital information using their existing workflows and existing forms, and present it to the service providers in a way that they could download or upload that information using just AI friendly or API friendly interfaces to get that information into their system of record for management, whether it's an EHR or a Salesforce system or a CRM, but to just simplify and streamline the process of enrolling in services is the goal. If Google provides the information, what role OneDegree? So Google will not be providing any. Google is just providing the funding. All of the information that we're training our AI chatbot on is information right now that OneDegree has curated. Obviously, we'd like to be able to partner, though, again, with the 211 networks to train the bots on 211 curated information to extend the reach of the project like that. But we're not letting the bots just browse the web without basically without supervision, because we've found that it tends to pull. It has a really tough time qualifying and curating information. It will pull anything, oftentimes not very good stuff. And is the AI Google Gemini? Actually, no, we're using, even though it's Google money right now, Google is basically just use AI. We're testing with Gemini, but we're also testing with Claude, and we're testing with Open ChatGPT. So we're using them all, and we're basically testing them against each other for the one that works best. So we're thankfully, Google has allowed us to be AI indifferent, or agnostic, at least at this point in the process. So it's great. I know our time is limited, so I just want to thank everyone for joining, and